Today, I want to talk about Astra-Zeneca vaccine. Specifically, I'd like to talk about how you can get the vaccine, how rare the blood clots that have been reported really are, and what benefits the vaccine offers. Right now, the vaccine is available to anyone in Alberta between the ages of 55 and 64. You can book an appointment at participating pharmacies across the province or online with Alberta Health Services. I am also pleased to announce that walk-in vaccinations are available at 26 participating pharmacies in Calgary and Edmonton. AHS will also open 2 walk-in Astra-Zeneca vaccine clinics on Saturday in Calgary and Edmonton. While these walk-in locations are limited to Calgary and Edmonton, you don't need to live there to get your dose. Anyone in the 55 to 64 age group, regardless of where they live, can walk into these locations and receive their vaccine, or find a participating pharmacy nearby to make an appointment. First of all, the main benefit this vaccine provides is how it protects against COVID-19. AstraZeneca's first dose reduces infection by 60 to 70% and reduces hospitalizations by 80%, including against the B.1.1.7 variant. Like any medication or therapy that has benefits, there are also some risks. The most discussed risk that has been associated with this vaccine is rare blood clots that the Public Health Agency of Canada is calling vaccine-induced immune thrombotic thrombocytopenia, or VITT. Essentially, this means that in rare cases, the vaccine can trigger platelets, which are a clotting agent in our blood, to clump together. This can cause blood clots to form and lowers the number of platelets in our blood. VIT is treatable. That's why it's important that everyone is aware of the symptoms, such as severe and persistent headaches or abdominal pain in the 4 weeks after receiving the vaccine, and anyone experiencing them doesn't hesitate to seek medical attention. With all the coverage that's out there, it can be easy to lose track of how rare these blood clots actually are. Let me give you an example. In the United Kingdom, where about 20.2 million doses of AstraZeneca vaccine had been given up to the end of March, 79 of these blood clotting events were reported in that time frame. That means that 20,199,921 people benefited from the protection that their AstraZeneca vaccine gave them and did not experience this rare side effect. So far, there has been 1 confirmed case in Canada and none in Alberta. We have received a small number of reports of people who have experienced blood clots in the 4 weeks after receiving an AstraZeneca vaccine. These are all being investigated to determine whether they are VIT cases. This involves a detailed clinical review by health officials and additional testing in some cases. The type of blood clot that is associated with the vaccine has a characteristic combination of low platelets as well as blood clots, and specific tests are required to determine if cases meet the criteria. We will let you know if a case is identified. These reports and the associated follow-up are signs that our safety system is working. The global frequency of VIT has been estimated at approximately 1 case in 100 to 250,000 doses of vaccine. In Alberta, someone between the ages of 55 and 59 who is diagnosed with COVID-19 has a 1 in 200 chance of dying from that infection. Risks are even higher of ICU admission and hospitalization. Albertans between the ages of 55 and 64 are at least 1,500 times more likely to be hospitalized from COVID-19 than experience VIT after getting AstraZeneca. This tells us that the syndrome is very rare, and in this age group, the risks of serious harm from COVID infection are much greater than the risk of this rare outcome. For anyone infected with COVID-19, they are much more likely to experience a blood clot from COVID. About 1 in 4 people hospitalized with COVID get blood clots. We don't yet have enough vaccines for everyone in our population, and those who would otherwise have to wait a month or more for Moderna or Pfizer vaccine can choose protection now instead of no protection while our transmission rates rise. There are no risk-free options with COVID-19, and this includes delaying getting a vaccine. It is my professional opinion that the benefits of these vaccines outweigh any rare risks that may be associated. Vaccines save lives, and vaccines will get us through this pandemic. As soon as you are offered a vaccine, whichever it may be, please take it to protect your health and the health of those around you.